All right, Coach Jeff here. Excited about today's stuff. Okay, so we've been working on the shoulder, glenohumeral joint. Now, the first part one was focusing on the rotator cuff muscles. Part two was focused on muscles that cross the glenohumeral joint, such as the pec major, latissimus dorsi, so on and so forth. Now, part three, we're going to focus on scapulothoracic stability, posture, and muscles, or muscles that affect those things, and movement, of course. So, scapulothoracic, fancy word for the shoulder blade. It actually consists of the clavicle and the shoulder blade, and then the humerus is attached to the shoulder blade via the rotator cuff. Okay. All right. So, self-check. Probably the easiest self-check that we do is shoulder flexion. That's usually one that will be affected the most. I'll show you a special test later, and also in another video we'll break that test down and talk about how we're going to improve that test. Now, this test at the end coincidentally is a very similar test in the FMS, or the functional movement screen, and I'll talk about that, but make sure you watch that because it's an important test too. All right, so self-check. Again, I'm going to go into the supine position, and then I'm just going to check shoulder overhead range of motion, shoulder flexion basically. And then I will show you again how powerful our breath work can be. So I'm going to lay here, and then I want you to know as well that I am not warmed up. I have not rolled, I have not done breathing or anything like that. So this is good because I'm going to work out after this. So there's my right shoulder. Boom. Monitor the rib cage. Stays pretty quiet here, and my thumb's touching the ground. Actually, I can even bring my thumb in and I go right to the ground. Really no hesitation. Maybe a little tightness, but no pain. Now here's my left shoulder. We all know that this one has been a little bit funky lately, so I'm going to come overhead, and that's where I stop. There. So there's the thumb abducted, and I can't touch the ground. There's pain. Don't want to go any further than that. Okay, so that's the self-check that I most commonly use. There's others, but that's probably the easiest one to do. So now I'm just going to do my breath work. Okay, remember 3D breathing. I'm going to breathe with intent into my lateral rib cage. Okay, obviously we want anterior rib, belly breath, expansion towards the ceiling, expansion laterally, and then I also want to feel the breath expand my rib cage into the floor or my neck. Okay, and I'm going to do 10 breaths here just to save time. I would probably work a little longer. The other thing I'm focusing on is relaxing the face, the neck, the shoulders, feeling the breath move down the spine into the sacrum, and just overall just monitoring tension in the body and trying to breathe the tension away. Also, not trying to rush through this. don't worry about what your belly looks like. Just let it expand. So I'm already feeling less tension. I'm feeling less. I have a little bit of low back pain. That's starting to decrease. So I'm at number 5 now. That's 7. And here's number 10. Okay, so I had a self-check, which was shoulder flexion. Just did a reset. Now I'm going to do another recheck or another self-check to see how my breath work has helped my movement. So here's my right shoulder. Monitor the rib cage. Yeah, that even feels better. Now here's my left shoulder. Just remember where it was in the pre-self check. Well, you can see that I can touch the ground. Still got a little pain at the very end range of motion. It's just a little bit of pain, nothing major, but you can see that just my breath work had improved my range of motion. Simple illustration on how important breathing, and that's why we have you breathe in class. And if you're managing pain, it doesn't matter what type of pain, not just shoulder pain, low back pain, hip pain, whatever, you should be breathing. You should be using this as a tool to manage your pain and improve your movement, okay? Not only improves movement, but as you can see, it improves range of motion. And in a lot of cases, it will help improve stability, whether it's the core, the hips, the shoulder. It's a fantastic tool. Okay, so talking about this stuff next, or posture assessment, is going to be fairly difficult without a model. So I'm going to use my hands to describe some of the postures that we're looking at, and then I'll show you on my body to help illustrate that, okay? And what I suggest here is that maybe you just take a video of yourself doing these posture assessments and movement assessments so that you can see what it looks like on yourself. I think that would be the easiest way to do it. Anyway. All right, so we're going to look at posture now. We're going to look at, I'm just going to take a look at my shoulders. Is one higher than the other? Now, we're not looking at whether my neck is tilted or ears closer to one shoulder. What we're looking at is the shoulder elevated? And that clue helps us decide what muscles to work on. Okay, so in this case, if I had an elevated right shoulder, then there's a couple of muscles that I would focus on and work on to help get that shoulder back into the good posture. Because if we don't have good starting position of our shoulders, we can't expect it to function well when we start moving. As simple as that. Okay, so that was elevation of the scapula, okay, or the scapulothoracic joint. And I need to note that on this thing, so I'll remember to do that. Okay, so that was elevation. Now there's also depression, and I'll show you what depression looks like. It's going to look like this, where my shoulder's really depressed, and I have a really pronounced downward angle. Okay, that might even be some downward rotation at the same time. So that's a depressed shoulder, and there's certain muscles we want to work on when that happens. That is a depressed shoulder. That is an elevated shoulder. So hopefully you can tell the difference. Okay, so you just want to look at that, see what that looks like. Sometimes it's hard to tell. If you have to nitpick, then maybe you need to come in, let me help you, or maybe there's nothing really wrong if you're really trying to nitpick your posture. Okay, so there's upward rotation. This one's hard to assess yourself. This is why I recommend doing it on a camera. But what you're going to look at is your shoulder blade. So these are my shoulder blades. We have an inferior angle right up here, and then sorry, that's the superior angle. The inferior angle's down on the bottom, and it looks like the pointy part of your scapula. But if the spine's in the center, you're going to see a slight upward rotation as a starting point. Okay, and then what we want to see is, as we go overhead, this is how we're going to check it. Overhead, the scapula should upwardly rotate, and then slightly wrap around the rib cage. So it goes like this and then comes back. And then we want to see it remain relatively flat on the thorax. Okay, so upward rotation, downward rotation. Okay, if the scapula doesn't have this slight angle to start and it's more vertical, then we're going to say we have a little bit of downward rotation. Then obviously if it's more than that, then it's really downward rotation, and that's when you're going to start seeing some postures like this. Okay, so upward rotation, starting point just slightly upwardly rotated, comes up and around, and then back down to that starting position. Shoulder blades should remain flat. The shoulder blades shouldn't lift off of the scapula. That's a hard one to assess, but anyway. Now downward rotation is anything from this position where we go vertical with the medial border, the border along the scapula is vertical, or downwardly rotated. So my pinky side is where my arms are, okay? The thumb side is depicting the spine side of the scapula. So if that's happening or that is happening, we're going to say you have downward rotation. There's certain muscles you want to work on. Okay, abduction. That's scapula's moving away from the spine. What we're going to do here is just hold our hands like this, and then we're going to watch. So this, let me take a step back. So when you're doing the posture, there's no movement. So you want to look at in upward rotation, that should be happening. Downward rotation, you're here or like that, okay? But then when you do movement, then you should see this stuff. All right, so sorry about that. I got a little ahead of myself. Okay, now in posture, the scapula is in the proper position. There should be an equal distance between the medial border and the spine on both sides. And then we're going to probably say you're okay as far as abduction and adduction goes. Now if one side's further, so say we're going to use my nose as the spine. If this one's out away further from my spine, we're going to say that one is abducted. In other words, it's further away from the spine. And we'd have to work on certain muscles to get that back. So here's where it gets a little tricky. If one's close to the spine, but one's pretty normal looking, then we'll say that one's adducted. In other words, maybe the rhomboids or the middle traps are pulling that scapula in. So it would be like this. That's adduction. This is abduction. So when the scapula moves away. So that just leads me right into the movement part, where if I do that, we're going to look at, is the movement the same on both sides? Do they equally move away from the spine? So arms are here. I'm going to do that, and then do that. And they should be the same on both sides, okay? When they come back together, you'll know if you're adducted, one will be closer to the spine than the other, or they should be the same. All right, I know that's probably hard to assess on yourself, but what we're looking for is really obvious things. If it's slightly off, not too worried about it, but if it's really obvious, that's kind of really what we're looking for, okay? All right, so muscles that affect all of that are the pectoralis minor. So this is my pec. Underneath it, going to the coracoid process, coming from third, fourth, fifth rib, is the pec minor. We're going to work on that, okay? You got to go through. I can go underneath and work on it, but if you're working on yourself, you're going to have to go through the pec major, okay? All right, and then you have the trapezius upper, kind of comes up here, goes up to the base of the skull, and then forms a kite. Comes down and goes towards my thoracic vertebrae, okay, the spine. All right, so it kind of looks like a kite like that. All right, and then levator scapula, and that is attached to the superior angle of the scapula and 1 through 4 cervical vertebrae, transverse processes, okay? And then the subclavius, this one's a little different because this is affecting that collarbone. Subclavius is like a muscle right underneath, and it actually a lot of times it's really tender. It's right underneath the collarbone, and it or the clavicle, it can keep the clavicle from rotating or pivoting as we go overhead. So, and then there's also the clavicular fibers of the pec major that affect that too, but you're going to get that when you work on pec minor, okay? And then underneath the traps, there's muscles right at the about mid scapula. There's rhomboids. Those get worked on a lot in therapy, and then finally right in here comes up, wraps around the rib cage and attaches to the medial border of my scapula underneath, and that helps keep the scapula stable and on the rib cage, because if the medial borders pop up, come off the rib cage, then we're going to have to do some work there, okay? So those are the muscles. I'm going to just show you how to work on them, and then when we go into the Apley scratch test, which is the special test later, then we can start to go into, okay, what's depressing the shoulder blade, what's upwardly rotating the shoulder blade, what is elevating the shoulder blade, so on and so forth. I'll go into some of the basics today though. All right, so pec minor, really easy. Find the wall, third, fourth, fifth rib. It's gonna be about middle to upper sternum out this way. So kind of the way my hand looks. The easiest way to find where it inserts is trace your collarbone or clavicle till it gets to this depression, and then just go down a little bit. You'll feel this kind of this bump. That's your coracoid process. The pec minor inserts right there on that coracoid process, and that could be really tender there, so that it's gonna kind of be oriented this way. And then, like I said, you can take the ball, roll it on the wall. You can use your hand in the ball, and remember how we talked about doing myofascial work, where I'm moving the tissue. So this is cross fiber here. This is with the fiber. Both are good to do. Maybe even perhaps I might like it better than just doing rolling. Anyway, so that's pec minor. While I'm doing this, I'll go underneath the collarbone and hit that subclavius and the muscles of the pec. So I really like grabbing the tissue with the ball, and I'm just moving my pec. I'm moving it around. Oh, that's kind of weird, huh? Okay. So that's pec, subclavius, and then pec minor. Okay, so that's kind of taking care of that anterior. Now, this anterior lateral, which is your serratus anterior, kind of going out of order here because I want to do all the stuff on the front first, is a little bit harder to do. One, you can roll. So if I'm rolling on the ground, I'm going to take this foam roll and roll on that lateral rib cage and get into rear delt, lat, and all that. Okay. So that's one way of doing it, and I'll demonstrate it, but that's kind of the target area. And it can be really tender, so just be careful or be ready for it. So I'll just lay on there. And yeah, I did a whole bunch of push-ups the other day, and that's pretty tender. So what I'll do is I'll just get right here and breathe into that roller. I can add a little bit of movement. I'm not going to worry about it too much. I can just move around, get right into that spot where there's the rear deltoid, there's the infraspinatus, the teres minor, the lat, all are converging in that area. And then again, I can do some range of motion work, internal external rotation. I can do some horizontal adduction and breathe. So that's how we're going to work on that stuff. Okay. Traps are pretty easy. The upper trap's a little bit harder to work on just because of their location. I usually will take a ball and then work on it in the wall, like where there's a doorway or something. So what I mean by that is I'm going to place the ball right on that upper trap. Then I'm also going to get the insertion point for the levator scap here. And this is more about compressing and holding and breathing rather than just moving around. It's hard to stay on top of the muscle. So basically, I just want to work this upper trap area. And then when you get to the top of the shoulder blade at the angle, you're going to get that levator scapula, and that one can be pretty tender. Okay. You can also MFT the upper trap fibers as it goes up the neck, and it's just basically grabbing a hold of it and moving. You can see how I'm just moving the tissue. That works really good. Okay. All right. So that's upper trap, middle trap, lower trap, easy. Just roll the muscles on the back side. And along the wall. Roll along the spine, roll along the scapula, roll on the scapula, come up as high as you can. So you're going to go down to about the TL junction, but upper trap's here too, so I'd roll all that. Okay, that's kind of the upper middle trap junction there. So that's your upper trap, middle trap, and lower trap. Lower trap goes all the way down here, kind of like a kite going diagonally down to your spine from your shoulder. Okay. Rhomboid major and minor. That's right underneath the scapula or the trapezius, and it's going to be about mid back, mid upper back, right in here. You'll feel that it's the deeper muscle. And again, right between the shoulder blades, up and down. You can do some movement and work on it, both sides. And I'm just holding pressure while I move. And then you can go up and down, side to side. Okay? So that's working on the muscles that affect the scapulothoracic joint. Okay? So this video is pretty long, so I want to stop there, show you Apley's scratch test, and then we'll break this down a little bit more according to the postures and movement. Okay? I know long series, but shoulder's pretty complex, and we want to break it down so that we can digest this information a little bit easier. Okay, so Apley's scratch test is flexion, abduction, and external rotation, and it looks like this. Okay, so my goal is to try to reach the scapula on this side. All right, and then the other half of that test is extension, adduction, and internal rotation, and it's this. And I'm trying to reach that scapula with my fingers. And basically, you just want to test left and right side, so I'm going to show you the difference. Not too bad here. This is where you're going to see the difference. Yep. So I don't have as much range of motion in my left shoulder. Okay, so that's the Apley scratch test. We'll break that down next time too. All right, hopefully this helps. So remember, just if you need help, give me a holler, follow the video, hit all those muscles, and you're gonna improve your movement. Thank you.